Okay, next up we have Kathryn Keating. She's a PhD candidate at LSU, and she's going to be talking about an overview of the research on mental health in the years following Deepwater. And as part of that research team at LSU Department of Sociology, her research has focused on child and family resilience following disaster.
As Missy said, I'm Kathryn, and I'm a PhD candidate at LSU. I'm here on behalf of myself, my advisor, Dr. Tim Slack, and our other colleagues at Louisiana State University who've been involved in some of the research efforts that I'm going to talk about today. So I'm going to talk about mental health following Deepwater Horizon, and I'm going to focus in on child and family mental health because that's what my research focuses on, but I'm also going to talk about other research efforts that have been going on in our department. And one thing to keep in mind when we're sort of thinking about this topic in particular is that there's no perfect way to study mental health following disaster. There's a lot of different approaches, and each one has strengths and limitations. There we go. Okay, so I'll quickly go through this slide. I'm sure there are a lot of people here who know all this information already, but the Deepwater Horizon spill occurred in April of 2010, about 50 miles off the coast of Louisiana. 11 people were killed in the immediate explosion, and then the wellhead continued to gush for months afterwards. So it's the largest accidental marine oil spill in history, and it set in motion kind of a cascading process of ecological and social damage. So the natural environment was disrupted, and also the people that were living in the areas that were disrupted environmentally experienced impacts on health and social functioning. So just some guiding ideas on that sort of guide the research that I'm going to talk about are the concepts of resilience and vulnerability. And I know we've talked about resilience a bit in our breakout groups earlier, but just the broad concepts here. So with resilience, these are attributes that can shield people from negative disaster impacts, or they can provide adaptive capacity. So when a shock occurs, something like the spill, which can produce like a physical impact or an economic impact, resilience is our characteristics that allow people to cope and recover. And then kind of the opposite end of that is vulnerability. So these are attributes, and these can be at the individual, the family, the community level. These are characteristics that may make people more susceptible to negative disaster impacts. And we all possess a variety of social characteristics, and as sociologists, we can call that a status set. So everybody in this room has a different set of social characteristics that are going to make them differently resilient or vulnerable in the event of a disaster. And this figure is a conceptual framework that kind of guides some of the research I'm going to talk about. I know the font size is a bit small, but I'm just going to talk through the general concept. So it's called the Resilience Activation Framework, and what it sort of attempts to do is connect community resilience attributes and individual, and how they interplay with each other when exposure to harm occurs, and that can affect individual mental health. So when we're thinking about community and individual resilience attributes, we have things like human capital, so education, skills you may have, economic capital or finances, or the job that you possess. When we think about social capital, those are the relationships that we have that we may be able to leverage in the event of a disaster. And then political capital is the way that people are networked or not networked in the community. So these are just a couple of different types of like social capital that can function at these two different levels, and they can either buffer or moderate the exposure to harm, in this case, the Deepwater Horizon spill. So just some background on oil spills and mental health. So there's a robust body of knowledge that connects the experience of disaster in general to mental health outcomes and individual well-being. And a majority of these studies are cross-sectional. And I'm going to talk a little bit about different approaches to studying mental health following disaster. And when I say cross-sectional, it means you take sort of a snapshot, one point in time of the population, and you're able to get an idea of what's going on for the group that you've surveyed or studied just in that one period of time. There's also longitudinal research, which follows people over time, and repeated cross-sectional is where you take snapshots of different people from the same population over time. So the previous literature shows us that oil spill exposure is associated with a higher prevalence of post-event distress, depression, anxiety, PTSD, and that social and economic support act as moderators for these impacts. So when I say moderators, what I mean is that these characteristics, sort of like I just talked about, they can kind of buffer or moderate the impacts. So if something like an oil spill creates an economic shock to a person, an individual with more modest means may experience that shock differently than somebody who has savings that they can rely on to sort of cushion themselves from that. Now, a bit about child and family mental health. So we know that the experience of disaster unfolds differently for children because they are nested within the family system and they rely on the adults in their life, not just parents, but also adults in the school system, other adults they interact with for safety, consistency, and support. And families may experience negative economic impacts in the years following a spill. And for children, spill exposure has been associated with increased mental health distress and lowered academic achievement. So I'm going to move into talking a bit about some research efforts that have been going on at LSU Department of Sociology. And two of them are efforts that my colleagues have been involved in. So I'm going to provide an overview and talk about some key findings. And then the last one, the Resilient Children, Youth, and Communities, is the project I've been more closely involved in. So I will go a little more depth in that. So the community oil, and one other thing to mention, all of these studies are funded by GOMRI, and the RCYC study also received funding initially from Baton Rouge Area Foundation. So the community oil spill study was a repeated cross-sectional survey looking at social and economic impacts in the years following the spill. The Consortium for Resilient Gulf Communities is a project led by RAND Corporation, and multiple institutions were involved in this, and I'll talk about one survey that LSU was involved with for that effort. And then the Resilient Children, Youth, and Communities project is a mixed method collaboration between LSU and National Center for Disaster Preparedness. So I'm going to go ahead and just give you a little bit of an overview of the COSS study. So this was a telephone survey of about 1,000 people living in coastal areas of Plaquemine, Lafourche, Terrebonne Parish, and in Grand Isle, Louisiana. These are places that were heavily impacted by the spill. The first, and it was a repeated cross-section, so it took a snapshot of this population, different people each time, but a snapshot of this population at different points in time. So the first survey was done while the wellhead was still flowing in June of 2010. The second one was in October of 2010 after it had been capped, and then on the anniversary of the spill for 3 years, the survey was conducted. And it asked a whole variety of questions on social and economic impacts. So a couple of key findings that have come from this effort. So the first is that a few studies coming out of this survey have shown disproportionate negative mental health impacts for fishers. And with fishers, we think about renewable resource communities, so people that depend on a renewable natural resource like fish. When an event like an oil spill occurs and it damages or creates a problem with that particular resource, that's going to differently affect the population that depends on it for livelihood versus folks that are not employed in that industry. And I'll talk a little bit about impacts on fishers with another study as well. And then another finding from the study is that greater community attachment is initially associated with negative mental health impacts, but over time, more attachment to the community is associated with positive mental health outcomes. So in the beginning, right after the oil spill occurred, people that were really embedded in the place that they lived were showing higher incidences of negative mental health outcomes, but then over time, that embeddedness turned into a resilience factor and they recovered more quickly. So the STRONG survey was part of the Consortium for Resilient Gulf Communities. This is a longitudinal survey, so follow the same people over time. of a little over 2,500 coastal residents in Texas, Louisiana, Mississippi, Alabama, and Florida. And the first wave was conducted in 2016, with the second in 2018 that was expanded to include folks who had been affected by Hurricane Harvey. And a couple of key findings from this survey that relate to mental health so spill exposure was linked to greater illness and anxiety, and this is something that I've heard come up a few times this morning. Folks who had been exposed to the spill were more concerned and worried about their health. Another finding, thinking back again to Fishers, shows that greater social support is linked to lowered odds of depression for people who are not Fishers, which is expected, right? If you have more people around you supporting you, you may be buffered from those negative mental health impacts of something like a spill. But for people that were Fishers, greater social support was associated with higher likelihood of negative depression, of a positive depression screen. And so that suggests that the networks that people are in may make a difference in terms of how they're associating with other people and how their mental health outcomes are happening as the years go by from the spill. So these are two quick research efforts that LSU Department of Sociology has been involved with, and now I'm going to do a little bit of a deeper dive into the Resilient Children, Youth, and Community Study. This is the project that I've been most closely involved in. So this is a mixed methods project, which means we use a couple of different methods to try and understand the social and public health impacts of the spill. And the focus is on the experiences of children and family over time. And when I say mixed methods, we have a 3-way longitudinal data set. So a survey with the same parents at 3 different points in time, and then focus groups with a subset of those people, and a social media analysis. And I'm going to talk a bit about each one of these as they relate to mental health. So to start out, the objectives of the project, asking what are the social and public health impacts of the spill? What attributes of households are related to greater resilience to disaster? Because we collect information on children, parents, and the household in general. And what role do online networks play, and how do all of these change over time? So because this is a longitudinal survey, we can look at the change in an individual over time, either an individual household or an individual respondent. So the face-to-face household survey is a 3-way survey. It was conducted in 7 parishes or counties in Southeast Louisiana. So we surveyed in St. Tammany, Orleans, Plaquemine, Jefferson, Lafourche, Terrebonne, and Vermilion parishes. And this is a face-to-face survey, so our field interviewers went out in person and met with the parents that participated in our survey and conducted approximately a 45-minute survey every 2 years. And it's a great deal of work to sort of collect these in-person surveys, but one of the things that came out of it is we had a great retention rate. So when you're doing these longitudinal surveys, it's really important to try and follow up with as many people over time. And so in the first wave, we had 655 parents participate. The second wave, we had 484. And this slide isn't updated because we finished our data collection this winter, but we actually followed up with 484 again in wave 3. So we had a great retention rate. And I think just in being really closely involved with the outreach for that, our respondents are parents who had children under 18 at the time of the spill, so they're really busy people. And, I think what was sort of motivating for them to sit down and continue contributing to the research was just knowing that they were, contributing to the development of a better understanding of this event. And our field interviewers would talk about that quite a bit when we would come back and touch base every week. So, and I think just to speak to that a little bit more, it is really important now that we are finished with our survey effort to, produce research. It's also really important to do outreach with this information because the people in our survey really want to know, and the people living in these areas really want to know what the outcomes of these efforts are that they've participated in. And making it accessible in things like workshops and events is really important. So like I said, the longitudinal design allows us to capture change over time. And the areas in Louisiana were selected based off of impact from the spill. So this is a preliminary findings graph that I just want to share. Like I said, we just finished our third wave of the survey and we're preparing the data for full analysis. It will also be publicly available online. But this is a graph that shows the odds of a child in our survey having a mental health symptom in 2016 and 2014 based on different types of exposure. And one thing to keep in mind about odds, when you can see the number at the side of the graph there, anything over 1 is an increased odds. So 1 to 1 is completely even odds. So if a child had lived in a household with a job loss, if it's 1 to 1, there's no difference. But anything over 1 means that if the child lived in a household that had one of the top 2 exposures, which are indirect and economic, or the physical exposures, they had increased odds of also having a reported mental health symptom. And one of the things I think is interesting about this graph, although it is preliminary, it only shows the first 2 waves of our survey, is that you can see that for the 2 economic types of exposure, as well as our 3 physical exposures, so exposure by smell, physical exposure of the child, and physical exposure of the parent, the blue bar, which is 2014, so closer to the spill, you have the highest difference in odds if the child had experienced that exposure. And when you look at the orange bar, which is 2016, the more recent of the 2, the odds are still greater for a child that had experienced that type of exposure to also have a mental health symptom, but we see it sort of diminishing over time. And so, you know, once we have all 3 panels, we'll be able to add in the third and see if that effect continues. So a little bit about the focus groups, because a big part of the RCYC project and effort went into collecting all of the survey data for respondents. But we also did focus group component to add a qualitative element to the research. And so in November of 2017, between our second and third wave, we conducted 6 focus groups in the communities where we had surveyed for wave 2. And we invited our participants to come and sit down and have about a 90-minute conversation where we tried to get more in depth about some of the questions we had asked in the survey. So we have many hours of conversation that we transcribed and we put in for themes, and we're working with that right now. And what's cool about the focus group data is that it can be analyzed on its own, just as qualitative, but you can also put it up against the survey data to sort of give a little bit of a deeper dive and a better understanding of what you're seeing with those numbers. So these are just 2 quotes that I pulled from the focus group that I think sort of illustrate the nuance that can be captured in these kind of conversations and also speak to different types of experiences that people have following something like this, the Deepwater Horizon spill. So the first one up at the top there sort of speaks to layered experiences of disaster and vulnerability. So this person said, "We just got back from Katrina, destroying our whole house. Everything was ripped out, ripped up, everything. We got rid of everything. The whole house was just a frame. So we started from scratch, and then that was when this happened." And the second quote sort of speaks a little bit to economic effects. So the person speaking here is talking about changing their fishing business. And they said, "The trolling business is not doing good. We went back to school, me and my husband, we got our GED diploma, we're now in college, we're starting our PCT classes to become nursing assistants. We turned this big shrimping and oystering and all that is good for us now. We have to actually look for higher quality things that don't need the lifestyle we used to in the value life." So I think that quote is interesting because it captures adaptation, it captures sort of a loss and a change from the lifestyle that this person obviously feels attached to, but they also feel like they're doing something higher quality. So I think I'm running out of time, so I'll just go quickly past the social media analysis. Our partners at Columbia are analyzing a sample of 500,000 tweets. looking at how people communicated about the Deepwater Horizon spill and health using Twitter at the time. And just a few takeaways. So the spill has been associated with a wide range of negative mental health impacts. And these impacts are different depending on what social characteristics and what sort of social status that you possess. And they change over time. And research on other oil spills suggests that these impacts will continue to change over time. So I will go ahead and stop there. And I appreciate the chance to come and talk to you. I know this research was largely focused on Louisiana, but I hope that it contributes something to the discussions in the next 2 days. And thank you.